My name is Zuraimi Ghazali. I am the Secretary of the Cleft and Palate Association Malaysia. So, shortly called Klapang. So, we are a support group, family support group for parents with cleft lip and palate children. And we are NGO, non-profit organisation, and we serve the whole nation, whole Malaysia, Sabah and Sarawak included. So what we do is when we get calls from hospitals where cleft babies are born, especially in Klang Valley, the doctors will call us, and we will need, before COVID time, we will usually go to the hospitals to visit the parents at the ward. We'll bring what we call a starter pack, which consists of a feeding bottle with a teeth and a spoon, or this type of spoon. Now we have this type of spoon. And bottles, we have two types of bottles now. This is soft glass and this is mum. Both you cannot buy at the market. Not so online at Shopee or Lazada. It's only with us. And this we bring them from overseas. So the special thing about the bottle is it's soft, and you can squeeze the bottle. And see, you can squeeze. So the starter pack will consist of a feeding bottle with a teeth. Before we used the NUK teeth, but now they have discontinued the teeth. So we have replaced it with FAQIHAH. So the parents will get a set of the bottle with a spoon, either soft glass or the mum type, mum bottle. And the spoon, now we have two options, the soft type of spoon or the hard type of spoon. So both can be used. But the teeth, now we use the FAQIHAH teeth. But so when we go to visit the parents at the ward, we usually counsel them so that they don't feel bad about having cleft baby, because the mother, when you've been carrying your baby for 9 months, suddenly you get a cleft baby, you feel very sad, and you feel that, what have I done wrong? It's like, oh, it's a curse or something like that, right? So there will be all sorts of emotions, and whether they accept their baby or not. Sometimes they like, you know, I've done something wrong. So there will be, you know, all kinds of emotions. So we go there, see them, and we try to counsel them and see, because cleft is a non-life-threatening condition. It's not a disease. It's a condition at birth which can be repaired. I will share with you the cleft protocol that has been established for years, and Malaysia practices it, and we have the experts who can handle these cleft cases. So in Klang Valley, the bottles, if the mother don't have the bottle yet, the mother can go back, discharged from the ward, but the baby has to stay until we come to visit them. So usually we would try to respond any calls from the hospital within 24 hours. Either we go there within 24 hours, or we contact the parents within 24 hours and make arrangement when to see them. But we'll try to come as soon as possible. But for the past 2 years, because of COVID, we managed differently. One, we will courier the bottle to the parents, so they pay the courier charges. And or if they really want it badly, like a few cases, they send a rider to our houses, either my house or Puan Fitra's house or Puan Syarul's house, to get the bottle quickly and send to the hospital. So that's how bad they want, because without the bottle, the babies, they'll give a tube to feed, because if not, the baby will be hungry, right? Waiting for the bottle. So they'll be given the rice tube until they get the bottle. And so that's why the urgency to get the bottle. So once they have the bottle, if the mom has been discharged, is at home, she'll be called back to the ward to what they call the rooming in, room in with the baby, and the nurses will teach them how to feed the baby. So once the mother is comfortable feeding the baby and all, and the baby is feeding well, not choking, all those, she can be discharged with the baby. So upon discharge, they will be given an appointment, follow-up appointment, to see a pediatrician and also to see the plastic surgery team at the hospital, because hospitals in Klang Valley, there's a few hospitals that can do plastic surgeries. So that's that's how the first step that we help parents. Yeah. The telltale sign is the milk coming out from the nose.
Yes.
Yeah, because there's a gap between the nasal cavity and the oral cavity. So the milk goes to the nasal cavity and it oozes out. So that's the first telltale sign lah. The other one, the baby will not thrive. The weight will not go up because the feeding is an issue. So maybe mothers, their reflex is to feed the baby, right? Direct breastfeeding. So when she tries to breastfeed the baby, because of the cleft inside, the baby cannot do 100% seal. Because to breastfeed, for a normal baby, the palate is closed and your breast goes inside and you are supposed to seal, 100% seal. You can the suction will bring out the milk.
Yes.
The baby memang instinct dia, reflex will suck. Naturally, it will suck. So the sucking will induce the hormone to produce milk and the milk will come out. But if there's a hole, the seal is not 100%. So the baby will need more energy to suck the milk out. So sometimes the baby is so tired, cannot feed. And then if they feed, it will ooze up from. So cases of cleft palate undiagnosed is we do find cases like that. So for those cases, the parents can bring the child to the nearest hospital to get advice from the doctor, and the doctor will get them to get in touch with us, and we will try to help the parents out. Not many people want to be associated with cleft, because especially for Malays, is not only Malays and Chinese, Indians, they feel that it's something shameful to have a cleft, like you've been cursed having a cleft baby, you've done something wrong. This cleft can happen to anybody, whether you are a doctor or whether you are a fisherman or you are a farmer. Our members comes from all walks of life, from professionals, from all kinds, even for different races. It happens all over the world. So generally it's 1 in 700 birth, live birth, that will have a cleft baby. Of course, we welcome all kinds because we are self-funded, so we don't get grants from the government. This is for normal, like us. See the jaw and the lip, the palate is okay. For this is, you see the lip is okay, the gum up there is okay, but there's a cleft hole in the palate. And sometimes it's way at the back, because our palate, you feel with your tongue, the front part is hard,
Yes.
because there's bone inside, and the back is soft.
Yes.
So the front part is called the hard palate, the back part is called the soft palate. So sometimes it's just at the back, soft palate, and this type is usually overlooked because it's way at the back. So if the baby doesn't cry, you don't look into the mouth, you can't see. So the other type is unilateral, one side, either right or the left side, and also the palate. So if the unilateral, most of the time is on the left side instead of the right side, all over the world. Wallahu alam, don't know. That's what God created. So it's on the left side. And the other type is what they call bilateral, both left and right. So my son, he's now 31 years old. He was born with this, bilaterally and palate. And his palate, you put 2 fingers inside his mouth, there's a hole that big inside his mouth, all the way through the back. So the Cleft protocol is practiced worldwide. Babies at 3 to 6 months, they will do the lip first. And then 9 to 18 months, they will do the palate. They cannot do all at the same time. And then if the cleft involves the gum, they call alveolus, gum is alveolus, that will be done from 9 years to maybe 12, because they have to time when the permanent incisor come down, permanent canine. So that's why you need a team to monitor the growth of the teeth and all. So minimum surgery if the child has cleft lip and palate is 3. The lip, the palate, and alveolar bone grafting, the ABG, to patch up the hole on the gum. And they take the bone from the child himself, bone marrow, take it from the hip and plant it on the gum. So there'll be 2 teams doing the work. So at least 3. And then the treatment plan for a cleft child is from baby, monitor the feeding and all, and then monitor the growth until he's an adult. Because the teeth will be growing, the jaw will be growing, the face will be growing. So whatever you do, you're doing surgery to the jaw, the upper jaw, you disrupt the growth. So sometimes the upper jaw will stay to the back, and the lower jaw is free to move. So you get the case that normally when we bite, our bite is like this, right? The upper teeth go over the lower teeth. But most cleft cases, it will be like that. So if this happens, the child will have difficulty chewing food and speaking and all. So they may need what they call the jaw surgery to push this forward or to bring this backward. But that will be done when they stop growing. And about 18 and above. So these are the protocol that they need to follow. But apart from that, there's also issues about hearing. Because people say, what has got cleft to do with hearing? You cannot see the relationship. But actually there's a eustachian tube connecting, because this eustachian tube controls the pressure in the middle ear. So for cleft, especially cleft palate, that eustachian tube, the muscle is not strong. So it cannot control. So sometimes we'll get hearing infection. So if there's hearing infection, the parents didn't know about it and just let it be. The child may become hard of hearing because of block. Because a child learns to speak by hearing, right? Yes. You say something and the child will imitate. So that's how a child learns to speak. Even we learning new languages, right? That's how we do it. Yeah. So these are things that we tell parents to look out for. Hearing, and then when the child's because the palate, if done at the right time before 2 years old, let's say, the speech should be good. But if not done, the speech may be hypernasal. And if done, let's say at 5 years old, 10 years old, it still can be done, but the voice won't be as good as if done at the correct age. Because she's used to speaking with the air coming out through the nose. So she will have to relearn how to talk, how to speak, and how to the tongue placement pun will be different. Because if there's a hole in the palate, so the tongue can actually go up, go all over, right? So when you close the palate, so the tongue has to stay less. So the tongue will have to relearn. So speech therapy is important. So our hospitals, the government hospital, they have this service, the speech therapy service. They want to do hearing check, you have audiologists at the hospital and all. So you just follow the appointment that the doctors give. Nobody knows. The scientists have been trying to, make research and stuff, trying to pinpoint what causes cleft. They haven't find out what, but amongst others is multifactorial. Multifactorial, it can be any of the factors. One is they say lack of folic acid. Folic acid, usually they advise mothers who wants to become pregnant to take the folic acid before being pregnant, just to prepare your body and all, and then so that doesn't guarantee not having a cleft baby, but it will minimize cleft or any other syndrome, any other anomalies to a baby. And then the other one they say is drugs, certain drugs when you're pregnant, or alcohol, smoking, and then there's this epilepsy medicine for convulsion and all, that may cause it too, and also genetics play a small role, very small factor, because of age factor. And there's a new finding, they say diabetes. Diabetic mom, that can cause also. Oh yeah, now with the sophisticated machinery of the scanning and all, now they have 3D, 4D, and we've done so many antenatal counseling. So one case is that boy there, in the poster there. His name is Gerald. The dad, they are from Sabah. So this was like, I think it's maybe 10 or 11 years old already. So the dad sent email to us, say, my wife has been diagnosed with cleft lip and palate. Can you help us? So I said, yeah, sure. At that time we have surplus. We didn't have mom yet. So we have this special bottle. We'll send you a starter pack. And then we sent to Sabah. And I waited. Say, you haven't joined as member. You have to join now because membership fee is 10 ringgit for annual member, and this is free. This is actually cost about 130 for the whole set. So he said, can I not be a member yet? I want to wait for the baby to come. I'm gonna practice positive thinking, and they are Christians. I want to practice positive thinking. I don't want to think about the baby having cleft. I just want to concentrate my wife on her health. Just on her health, healthy baby, healthy mom, healthy baby. So the baby came out, and the sonographer who scanned the baby was shocked. Because when they scanned the first time, the cleft is really bad all the way inside. But when the baby come out, it's just a notch. Just a notch, it didn't even go into the nose. So he was saying miracles do happen, but you have to practice positive thinking. So like us Muslim, we tawakal and make doa. InsyaAllah, Allah will, grant you your doa. So you have to have a positive mindset. I mean, yes, you are going to have a cleft baby, but the baby is still forming inside you. So maybe, you make doa, Allah want to grant you doa. Maybe the cleft is not that big, but if Allah said, no, you're still going to have it. So when the baby come out, you are prepared. You know what to do. You know how to feed the baby. That's why we do antenatal counseling. Talk about the mom should be looking after her health. Mentally shouldn't be too much focus on the cleft. And no more research on internet. Because internet, the sharing is so much, overload of information, and you'll be so confused, which is right. Oh, my baby is going to be this, my baby is going to be that. So you haven't seen your baby yet. So the focus is to, you take care of your baby, you make doa, you read a lot of Quran, as a Muslim lah. But kalau non-Muslim pun, we just tell that Jerry and his wife did positive thinking. So insyaAllah, that's the way. Minimum requirement, 3 months, 5 kg, weight has to be about 5 kg for lip. If for palate, they have to be about 9 to 10 kg. Then they can do the palate. And then good health and no syndrome. Because if there's other issues, like maybe the heart has problem, other issues, because the heart is more life-threatening. It's life-threatening, right? So you have to arrest the heart first, then only do the lip, because the lip is non-life-threatening. In fact, there are adults who's walking around not doing anything to the lip or the palate, and they survive because it's not life-threatening. You can live, you adapt. In terms of feeding, you adapt. So the parents will be advised by the surgeon, by the surgery team when you come for the appointment, because usually they manage this very well in the hospitals all over Malaysia. The big hospitals will have this team. If they go to government hospital, the government highly subsidize the surgery cost. So the parents, if they are what they call it, pejawat awam, works with the government, they bring GL is free. But if like me, my husband works private, no GL, nothing, I will have to pay about 100 ringgit or so. The rest is the thousands is paid by the government. But we only pay about 100 ringgit. Even that, there are families that cannot afford that. So that's where we come in. They can get funding from Cleft. Per case basis, we help. And it's not only for surgery. Because after that, they have to do orthodontic follow-up and all. Orthodontic pun sometimes, now the orthodontic even at government hospital is 1,500 for the whole treatment. At university hospital, they also do that. So it's going to cost a few thousand. They can come to us. We have the form and we need the document and we will process. We will help them. It's not, Cleft is not only about surgery. It's the whole work. The gap, if not done, it will grow. But until a point when they stop growing, it will just be that size. But to do the surgery, some parents about plastic surgery. I mean plastic I tampal kat situ. But it's from the tissue from within your mouth. So usually when I explain to parents, simple layman term, kepak kiri, kepak kat kanan. So jahit tengah-tengah, you know. So left and right flat, and they stitch up in the middle. That will be the new palate. But it's more than that lah. But to make the parents understand simple, so that they can imagine. So it can be done if they miss the boat, it can still be done. But more for function lah. The food won't be coming out through the nose. But the speech, it doesn't really help the speech because they are so used. But there will be less air going out. The speech may be a bit clearer, but the hypernasality will still be there. They will need speech therapy. Because it's to correct the bad habits of speech. That one quite big lah. Especially if it's cleft lip, it's obvious, it's physical. But if it's not done at the right time, they may have, self-esteem, people looking at you. In fact, if those that done it, but maybe the scar is still there. I mean, the scar will be there, but whether it's very obvious or not. But nowadays, we have this special cream. One of it is this brand, the Mantis. At one time, this company gave it free to us. So you're giving free to our members. Now discontinued, but you can find it online lah. Dekat pharmacy pun ada. This is one of the brand. But this does is to minimize the scar. So that's why you look different. But nowadays is beauty. With the social media, everything's beauty, dengan selfie, dengan apa semua. So that's one. Self-esteem. And then you're so conscious. And if you don't do your palate, your speech pula. So hypernasality, people don't understand you. There's some people who bring a paper, write it down. This is what I'm saying. That until that bad. So that it will affect their communication with people. But the thing is, we as a public, we need to help them. We need to understand why they are like this. So try to be sensitive about it and try to help them. Kan, of course, and children can be mean. You know, when go to tadika, kenapa tu?
They are so
You know,
honest.
So you will, as a mother, you will have to train your child how to address this, what to say to your friends, so that they are prepared.
Filter your words.
Yes, so that they are prepared. Sometimes it's not about teasing actually. They don't know.
They are so honest, like they are
Ah,
curious.
The kids they just yes, keluar je daripada mulut kan. So you have to train your child to how to defend themselves, you know, how to cover themselves. And the teachers, and you guys will be teachers juga nanti kan. The teachers play a role. These children will have a lot of appointment back and forth going to see doctors and all. So do not penalize them for not coming to school. Yeah, there are reasons why they have to go for the checkup. And we as the public, you look different sikit. Start lah, you know, you don't isolate them. You know, you try to help them. Be them, make them part of the society. Help them out. Macam tu lah. Long term, if not done, one would be speech lah. Hypernasal and all. If the parents are not aware of the side effect of the hearing and all, and the child, there are cases, a lot of cases, very sad cases that neglect to look after that, the child becomes deaf and have to use hearing aid. That one different. Because the one that I say may be associated with syndrome. If that's syndrome, then maybe they have something wrong with the brain function or something like that. Maybe that one you have to go see the specialist and have that checked out. Not all cases. Very few cases that some have global developmental delay kind of thing, and when they they have also cleft palate, but not all cleft palate cases will have learning disability. Maybe in school they will be having problem. You know, some to maybe yang have they cannot hear that well, and in class they sit all the way at the back. They cannot hear the teacher teaching. So people say, oh, this child not paying attention. But they see, he cannot hear. Or maybe he's trying to express himself, but because of neglect, not doing the surgery, you know, they cannot present themselves. Those kind of things. But overall, cleft children can be whoever they want to be. There's a lot of success stories. I mean, you have both success and non-successful people, but plenty of cleft stories to share with, you know. They can be normal. First, the parents have to accept. Acceptance is number one. Because if you don't accept that your child is a cleft, you cannot move on. Because if you don't accept, then you don't care. I'm not going to take my baby for treatment. You just won't care. But once you accept, you will try to help the baby, because the baby don't know anything. You will try first by feeding, because if you don't feed the baby won't grow, won't thrive, and then won't have the ideal weight to do the surgery. That's the first thing. So coping skill, and they will need help from the immediate family. So if the immediate family don't give support, you cannot go on. You cannot do this on your own. And then from the public, because we have cases that kawan saya tahu wife saya mengandung, sekarang dah bersalin. Saya tak nak share lah anak saya dengan nanti orang kata apa saya. So they are scared what people will say. So that's another coping skill that you will have to educate your friend. You have to be open. Itulah acceptance lah. Once you accept, some people they don't want to share, don't even want to bring the baby out until the surgery is done, because they feel ashamed. But now there are celebrities that have cleft children,
public
and they share.
Yeah.
They don't care. This is my baby. Oh, now done the surgery, and then that is something positive that other people will. Oh, okay, So it's good to share. And then some parents, they keep the photos of, that's what I did actually dulu. Keep the photos of the cleft babies, tak nak tunjukkan. But the thing is, it's good to keep share, so that they know, kan. So my boy, when he was I think about 9 or 10, he was because he did speech therapy, and the speech therapist was saying you should go to in front of your class, share your baby photos. So that's what he did. He's 10, he share with his friends. This is how I look. This, I've done this. So the children, it's an education to them. So that's how another coping skill for the parents to help children to understand their cleft, and to educate the public. And we as public, we have to be open about it.
So public, parents, and also the child.
Yeah, and it's actually family acceptance juga. Because there are cases that they blame each other and they end in divorce. And neglect to the child. And last year, we introduced the Cleft Awareness Month in October. So that was last year, and YBKJ sent a short video because that time COVID, so he couldn't come. So sent a short video saying that from last year, every October is the Cleft Awareness Month.